Hello, my name is Dr. Chris Christensen from Lexington, Kentucky. I'd like to discuss toga safety for you and your staff and give you a couple tips in under 2 minutes. First off, these are not the negative pressure spacesuits that Charlie brought to the operating room over 60 years ago and dramatically improved infection rates. These are positive pressure togas where fans are blowing air onto the surgeon's head and body, keeping him cool. These are more mobile, they're more comfortable, but they also needed to be treated with care and respect. These are very valuable. They protect the surgeon and staff from blood and bone debris that gets in your ears, your eyes, your nose, your mouth. But again, you're inviting a fan into the operating room, and when 4 to 5 people are coming in before your joint replacement and all of them have the fan running, you're dramatically increasing air turbulence and you're almost crop dusting the operating room. So tip number 1 is to make sure your fan is off before you enter the operating room and that your staff understands the importance of this. Tip number 2 is to encourage your staff to wear their togas with the fan running at the lowest speed possible. Tip number 3 is to seal the glove gown interface. I use IOBand, and I try to avoid doing this and ignore this for years, but the data is just too overwhelming. Dr. Spangle from the Mayo Clinic in Phoenix has written about this extensively, and this graph by Chen in 2023 clearly demonstrates that there is elevated bacterial contamination when you're wearing a hood with a fan and you are not sealing the glove gown interface. And rule number 4 is to simply turn off your fan before you take off your gown and gloves as you finish the operation. That's it. Thanks for your attention.